Nclex PN. Nclex PN. Ready, set, go. Go to a quiet place. Sit down and relax. Let all of the tension go from your head down to your feet, going over every muscle in your body that could possibly block energy needed for concentration. The only thing you have to do is listen and absorb what you're about to hear on this audiobook. Let every other concern go. Concentrate on listening for the allotted time you've set aside for the Nclex test preparation. If you become distracted, stop and remind yourself that your sole concern is to focus energy on listening and learning the information required in order to ace this test. Know that you have the power to absorb the right answers and recall them at will. Feel free to turn off the tape at any point and repeat what you've heard in order to better grasp the material. Contents: care environment, coordinated care, safety and infection control, health promotion and maintenance, psychosocial integrity, physiological integrity, basic care and comfort, pharmacological therapies, reduction of risk potential, physiological adaptation. Introduction. According to the National Council of State Boards of Nursing Incorporated, beliefs about people and nursing influence the Nclex PN test plan. People are finite beings with varying capacities to function in society. They are unique individuals who have defined systems of daily living that reflect their values, cultures, motives, and lifestyles. Additionally, people have the right to make decisions regarding their healthcare needs and to participate in meeting those needs. The profession of nursing makes a unique contribution in helping clients, individuals, family, or group, achieve an optimal level of health in a variety of settings. For the purpose of the Nclex, a client is defined as an individual, family, or group, which includes significant others and population. Nursing is both an art and a science, founded on a professional body of knowledge that integrates concepts from the liberal arts and the biological, physical, physiological, and social sciences. It is a learned profession based on an understanding of the human condition across the lifespan and the relationships of an individual with others and within the environment. Nursing is a dynamic, continually evolving discipline that employs critical thinking to integrate increasingly complex knowledge, skills, technologies, and client care activities into evidence-based nursing practice. The goal of nursing for client care is preventing illness, promoting comfort, protecting, promoting, and restoring health, and promoting dignity in dying. The practical vocational nurse uses specialized knowledge and skills which meet the health needs of people in a variety of settings under the direction of qualified health professionals. NFL PN 2003. The practical vocational nurse uses a clinical problem-solving process, the nursing process, to collect and organize relevant healthcare data, assist in the identification of health needs, problems throughout the client's lifespan, and to contribute to the interdisciplinary team in a variety of settings. The entry-level practical vocational nurse demonstrates the essential competencies needed to care for clients with commonly occurring health problems that have predictable outcomes. Professional behaviors within the scope of nursing practice for practical vocational nurse are characterized by adherence to standards of care, accountability of one's own actions and behaviors, and use of the legal and ethical principles in nursing practice. NAP-NES 2007. Registering for the Nclex PN test. According to National Council of State Boards of Nursing Incorporated, all those who wish to take the Nclex PN examination must 1. Apply for a licensed practical nursing license with the State Board of Nursing where the person wants their initial license. For example, if you went to school in Florida and want to get your licensed practical nursing license in Florida, you would apply for a licensed practical nursing license with the Florida State Board of Nursing. On the other hand, if you went to school in Florida and you want to get your licensed practical nursing license in California, you would apply for a licensed practical nursing license with the California State Board of Nursing. If, at a later date, you decide to work in another state after you get your initial licensed practical nursing license, you can apply to that state for your licensed practical nursing license without retaking the Nclex PN examination, because all states in our nation give licensed practical nursing licenses with a process called reciprocity. 2. You must meet all of the state's eligibility requirements to take the Nclex PN examination. 3. You then register for the Nclex PN examination with Pearson VUE, which is the official testing company. Your School of Nursing will provide you with this information and registration forms. 4. You will then receive your Nclex registration acknowledgement by email from Pearson VUE after the State Board of Nursing validates that you are eligible to take the Nclex PN examination. 5. The final step for registering for the Nclex PN examination is scheduling the date and time of your examination with Pearson VUE and paying the fees for it. If you have to change your appointment time for the Nclex PN examination, you must change it by using the Pearson VUE website or by calling Pearson VUE. This must be done at least 24 hours before your scheduled test date and time. For example, you must change your test time appointment by Friday at least 24 hours in advance of your appointment time, local standard time, when your examination is scheduled on a Saturday, Sunday, or Monday. You can register for the Nclex PN examination using a major credit card, such as Visa, MasterCard, or American Express, by either registering at the Pearson VUE website or by contacting Pearson VUE by telephone. You must have an email address when you register, regardless of whether you are registering by telephone or registering for the test on their website. Please note that Pearson VUE will not send any information or registration acknowledgments via the U.S. Postal Service. They only send this information by email, so it is your responsibility to have access to the Internet and to your email. The fees for the Nclex PN examination. The basic registration fee for the Nclex PN examination is $200. Additional fees are required if you change the State Board of Nursing that you want to apply to after you have registered, or if you change the language that you choose to use for the examination. There are no refunds of these fees for any reason. The length of the Nclex PN examination. The Nclex PN examination is a variable length computerized adaptive test. It is not offered in paper and pencil or oral examination formats. You may have to answer anywhere from 85 to 205 questions, depending on how you are doing with answering the questions on the test. Of the 85 to the 205 questions on the test, 25 of these questions are pre-test questions. These 25 pre-test questions will not be scored, and they will not be part of or included in your final test score for the Nclex PN examination. You will have up to a maximum of 5 hours to complete the Nclex PN examination, regardless of the number of questions that you will have to answer on this examination. This total of 5 hours includes a short tutorial about the examination that you will be taking, 2 pre-programmed optional breaks, which you may or may not choose to take. One of these optional breaks is pre-programmed 2 hours after the test begins, and the other optional break is pre-programmed 3.5 hours after the test begins. The computer will alert you when these pre-programmed breaks are due. Other breaks that you choose to take, and answering all of the questions on your Nclex PN examination, regardless of the number of questions that you have to do, up to 205 questions on the test. It is important to note that the time allotted for the examination includes the tutorial, sample items, all breaks, restroom, stretching, etc., and the examination. All breaks are optional. Although the maximum length of the Nclex PN examination is 5 hours, The length of the examination for you may be less depending on the number of questions that you are required to answer. After you have answered your minimum number of questions, based on how you have done on the examination, the testing will stop because the test taker is either above or below the passing standard. In other words, the test will stop when you have passed. The test will also stop when it is certain or almost certain that you have not passed the Nclex PN examination. The test will also stop when all the questions are done and also when the 5-hour time limit for the entire examination is over and done. Based on this information, it is in your best interest to maintain a reasonable pace during the test and take no more than 1 or 2 minutes on each question. Keep in mind that you may need the full 5 hours when you have to answer all of the available questions for your examination, which can number up to 205 questions. How the questions will appear on the examination. You will only get one question at a time on your computer screen. You can read the question and think about it as long as you like. But the question must be answered before you can go to the next question. You must answer the question even when you are not certain that your answer is correct. Do not waste time on a question. Give it your best try so you can move on to the next question. Wild guessing is not advised. Select the answer that you think is the best one and then move on to the next question. So you must read the question carefully. Think about the question, and then answer it with your best possible response even when you are not sure. Do not waste time on it. Do not get stuck on it. Remember, you only have 5 hours to do the entire test. Keep up a reasonable and consistent pace as you go through the Nclex PN examination towards its completion. Basic terms and definitions used on the examination. Now I will define some of the basic terms and definitions that you will see on the Nclex PN examination. When you see the word client, it is the same as patient. It can also refer to an individual, a family, or a group. A group is more than one client or patient. Groups can be defined as populations of people, age groups of people, and other groups of people. Nclex integrated processes are those processes that are recurring themes in nursing and the nursing process. The integrated process that you will see on your Nclex PN examination are the clinical solving problem process, also referred to as the nursing process, caring, communication, documentation, teaching, and learning. You will learn about all of these integrated processes during this audio Nclex review course. The word prescription is defined as an order, intervention, remedy, or treatment ordered or directed by an authorized healthcare provider, such as a doctor, nurse practitioner, or a physician extender, like a physician's assistant. The term exhibit indicates that you will see some picture or diagram, such as a client chart or medical record. Levels of questions on the Nclex PN test. You will see different levels of questions on the Nclex PN examination. The levels of questions on the Nclex PN examination include knowledge and recall, comprehension of the material, application of the material into nursing practice, and higher levels of the cognitive domain of nursing. The practice of practical vocational nursing requires the application of knowledge, skills, and abilities into all aspects of nursing care. Therefore, the majority of items are written at the application or higher levels of cognitive ability. Knowledge and recall questions are the simplest of all types of questions that you will get on the Nclex examination. An example of a knowledge and recall question is, who was the first president of the United States? A. Benjamin Franklin, B. John Madison, C. George Washington, or D. John Adams. The answer C. George Washington is correct. George Washington was the first President of the United States? This question is rather simple. It just tests your ability to remember facts that you have learned. Now here's another knowledge and recall question. Who is Lady who was known as the Lady with the Lamp? A. Martha Washington, B. Dolly Madison, C. Dorothea Orem, or D. Florence Nightingale? The answer to this question is D. Florence Nightingale. Florence Nightingale is known as the Lady with the Lamp. Again, this question is rather simple. It just tests your ability to remember facts that you have learned. Comprehension questions test your ability to apply a principle to a situation. Now, let's try a comprehension level question. Basic human rights are incorporated into our nation's A. Bill of Rights, B. Constitution, C. Declaration of Independence, or D. Edict of Nantes. The answer to this question is A. The Bill of Rights. Basic human rights are incorporated into our country's Bill of Rights. In this question, you had to apply the principles of human rights to our nation's legal documents. Now, here's another comprehension level question. What type of asepsis is used for the administration of oral medications? A. Surgical asepsis, B. Sterile asepsis, C. Medical asepsis, or D. Medication asepsis? The correct response is C. Medical asepsis. Medical asepsis is used for the administration of oral medications. In this comprehension question, you are applying the principles of medical and surgical asepsis to oral medication administration. Application questions test your ability to apply your knowledge into practice. Now let's see what application questions can include. Here's a question. You live in your home with your husband and 2 young children. What is the first thing you should do when the smoke alarms in your house start to go off? A. Call the fire department. B. Run out of the house. C. Use your fire extinguisher. Or D. Evaluate all members of the family. The correct answer is D. The first thing you should do is evaluate all members of the family. This comprehension question tests your ability to apply the principles of fire safety to a current situation. Here is another one. You are caring for a 7-year-old boy in the hospital. You've noticed that the boy is wetting his pants during the daytime hours when he is awake. What should you do? A. Admonish the boy. B. Call the mother. C. Understand that the boy is regressing. Or D. Understand that the boy is repressing. The correct answer is C. You should understand that this boy is regressing during this stressful time. This comprehension question tests your ability to apply the principles of psychological integrity to a patient situation. The types and kinds of Nclex PN test questions. In the past, all of the Nclex PN examination questions were only multiple choice questions, with only 4 choices from which the correct choice had to be selected. Now, these 4 choice multiple choice questions are still on the examination. However, new format questions have been recently added. Fortunately, the majority of the Nclex PN examination questions are still the traditional 4-option multiple choice questions, but be prepared for alternative format questions. All of the questions that I just discussed for the knowledge and recall, comprehension, and application levels were all traditional 4-choice multiple choice questions. Most of the 4-choice multiple choice questions are narrative type questions, but others can consist of tables, charts, graphs, audio clips, and images or pictures. For example, you may get a 4-choice multiple choice question that asks you to select a bodily part from a graphic image of the body. You may get a 4-choice multiple choice question that asks you to select the line on a line chart or graphic chart that shows a blood pressure of 167/85 on a graphic chart. Lastly, you may also get a question that requires you to listen to an audio clip by using your earphones and then identifying what you heard. Specifically, you may hear a particular heart sound or breath sound. You will then be asked the name of the normal or abnormal breath or heart sound that you have heard. The alternative and new format questions can also consist of tables, charts, graphs, audio clips, and images or pictures, in addition to narrative questions. The alternative and new format questions are multiple response questions that ask you to select all the responses that are correct. With this type of alternative and new format question, you will have to choose more than one correct answer. You will not get any credit for a correct response if you do not answer with all the possible correct answers. In other words, you will get no credit for the question if you only choose 3 of the 4 correct answers. There is no partial credit for questions on the Nclex examination. Fill-in-the-blank questions that ask you to fill in the correct answer to a calculation that you must calculate. Hotspot questions that ask you to find and click on the hotspot or the specific area that shows the spot that the question is asking you to identify. Ordered response questions that ask you to use the computer mouse and then drag and drop items on a list in the correct sequential order. All item types, including the traditional 4-item multiple choice and all of these alternative, new format questions, may include multimedia, such as charts, tables, graphics, sound, and video. Now, let's do several multiple response questions. Remember, you must select all the correct responses in order to get these questions correct. You will be graded incorrect if you miss even one correct response. Which of the following sports are considered contact sports? Select all that apply. A. Tennis. B. Football. C. Boxing. D. Golf. E. Basketball. F. Diving. G. Rugby. The correct responses to this question are B, C, and G. Football, boxing, and rugby are considered contact sports because contact is a normal part of these sports. If you only got 2 of these 3 responses, you would not get credit for this question. It will be scored as incorrect because you missed one correct response. Now, let's do a couple more multiple response questions. You are working the evening shift, and your hospital is alerted to the fact that a tornado is near and heading in the direction of your hospital. What should you do? Select all that apply. A. Cover the patients with moist blankets or towels. B. Move ambulatory clients to the hallway away from any windows. C. Evacuate non-ambulatory patients using the closest elevator. D. Do a vertical evacuation to a higher floor of the hospital. E. Lower the beds to the lowest possible height for bedridden patients. F. Close all window drapes and curtains. The correct responses to this question are B, E, and F. When a severe storm is possible, you would move ambulatory clients to a hallway away from any windows. This is to protect them from breaking glass and flying debris. You would also lower the beds to the lowest possible height for bedridden patients. This also protects them from breaking glass and flying debris. Lastly, you would also close all window drapes and curtains to also help prevent flying debris. Again, if you only got 2 of these 3 responses, you would not get any credit for this question. It will be scored as incorrect because you missed one correct response. Now, let's do our last multiple response question. Which of these are the role and responsibility of a licensed practical nurse in terms of an internal disaster? Select all that apply. A. Making urgent clients the greatest triage priority during a massive internal disaster. B. Communicating with family about the patient's status during this emergency. C. Participating in all internal disaster drills. D. Employing autocratic leadership skills. E. Communication with the media and press when asked to do so. The correct responses to this question are B, C, D, and E. The role and responsibility of a licensed practical nurse in terms of an internal disaster include communicating with families about the patient's status during this emergency, participating in all internal disaster drills, employing autocratic leadership skills during an emergency, and communication with the media and press when the nurse is asked to do so. Again, if you only got 3 or less of these 4 responses, you would not get any credit for this question. It will be scored as incorrect because you missed 1 or more correct responses. Fill-in-the-blank questions are used for calculations, such as the ones that you do for medication dosages and intravenous fluid flow rates. Now we are ready to do 3 fill-in-the-blank questions. How many milliliters are there in 12 ounces? Fill in the blank. The correct answer is 360 milliliters. There are 30 milliliters in 1 ounce, so 12 times 30 is 360 milliliters. Any answer other than 360 milliliters is incorrect. The doctor's order states that the patient should get 125 cc's of intravenous saline every hour. You are using an intravenous set that has a drop factor of 15 drops per milliliter. How many drops per minute will you administer? Fill in the blank. The correct response is 31 drops per minute. 125 cc's divided by 4 is 31.25, which, rounded off to the nearest whole drop, is 31 drops per minute. All answers other than 31 drops per minute are incorrect. Now, here is our last fill-in-the-blank question. The doctor's order states 6,000 units of heparin subcutaneously stat. The label on the heparin bottle reads 5,000 units per milliliter. How many milliliters will you administer? Fill in the blank. The correct answer is 1.2 cc's or milliliters. The answer is calculated by dividing 6,000 units of heparin by 5,000 units, which is 1.2 cc's or milliliters. If you write anything other than 1.2 cc's, it is marked as incorrect. Ordered response questions ask you to use the computer mouse and then drag and drop items on a list in correct sequential order. Here is an example. I will now read you the phases of the nursing process in incorrect sequence. Think about these phases. Then, place them in correct order from number 1 for the first phase to number 5, which is the last phase of the nursing process that is on the list. A. Planning. B. Implementation. C. Assessment. D. Nursing diagnosis. E. Evaluation. For this question on the Nclex PN examination, you would drag and drop assessment to the top of the list because assessment is the first phase of the nursing process. You would then drag and drop nursing diagnosis to the second spot on the list. Then, you would drag and drop planning to the third spot on the list, after which you would drag and drop implementation. Then, finally, you would drag and drop evaluation to the bottom of the list, because evaluation is the last phase of the nursing process. The phases of the nursing process in correct sequential order from 1 to 5 are 1. Assessment. 2. Nursing diagnosis. 3. Planning. 4. Implementation. And then finally, 5. Evaluation. I hope you understand this type of question. Let's try another ordered response question. Remember, when you are taking your Nclex PN examination, you will be asked to use the computer mouse and then drag and drop items onto a list in the correct sequential order. Here is another example of an ordered response question. I will now read you the phases of the pharmacokinetic process in incorrect sequence. Think about these phases, and then place them in correct order from number 1 to number 4 on the list. A. Distribution. B. Absorption. C. Excretion. D. Metabolism. For this question on the Nclex PN examination, you would drag and drop absorption to the top of the list, because absorption is the first phase of the pharmacokinetic process. You would then drag and drop metabolism to the second spot on the list. Then, you would drag and drop distribution to the third part on the list. After that, you would drag and drop excretion to the bottom of the list. Excretion is the fourth and final phase of the pharmacokinetic process. The phases of the pharmacokinetic process in correct sequential order from 1 to 4 are 1. Absorption. 2. Metabolism. 3. Distribution. And 4. Excretion. For obvious reasons, this audio Nclex PN examination review cannot show pictures for hotspots. However, we still want to prepare you so you know what you can expect on the Nclex PN examination. Hotspots can include anatomical pictures. This would require you to identify specific points in these pictures. Here are some examples of hotspot questions that could be included on your Nclex PN examination. You may be asked to identify spots on the legs and chest where you could place ECG leads, spots on the chest where you could place your stethoscope to hear a specific heart sound, like an apical pulse, spots on the legs that you would palpate for various pulses like a pedal pulse, spots on an anatomical picture of the developing fetus, like the umbilical vein, spots on an anatomical picture where a specific type of ostomy would be, spots on an anatomical picture that indicate a particular anatomic structure, spots on an anatomical picture that indicate the female's internal and external organs of reproduction, spots on an anatomical picture that indicate the male's internal and external organs of reproduction. Multimedia questions using sound and video will now be discussed. Again, for obvious reasons, this audio Nclex PN examination review cannot provide you with actual videos. However, we still want to prepare you so you know what you can expect. Video questions on the Nclex PN examination can include things like patient scenarios that you would view and then think about in order to answer a question. For example, a video may show you somebody washing their hands before providing care to a patient. The question would then ask you what part of the nurse's hand washing was not correct. One of the choices may be that the nurse only washed her hands for 10 seconds. If you saw the nurse washing for only 10 seconds, then the correct response would be, the nurse only washed their hands for 10 seconds. When you watch a video, pay very close attention to everything you see. Observe the patient, observe the nurse, and observe the environment and any other things in the video. Audio-based questions will now be discussed. The computer will instruct you to put your earphones on and listen to some audio segments. Breath and heart sounds will be used for these audio questions, although other sounds like bowel sounds could also be tested. Some of the sounds that you may hear with these audio clips are normal and abnormal breath sounds, such as vesicular breath sounds, crackles or fine rails, crackles or coarse rails, wheeze, Bronchi, bronchial breath sounds, pleural rubs, bronchovascular breath sounds. You may also hear audio clips of heart sounds, such as a regular sinus beat, an irregular heartbeat. A murmur. Tachycardia. Bradycardia. S1. S2. S3. S4. Tips to take you to the top. The most important thing that you must bring with you when you take your Nclex PN examination is your self-confidence. Think about it. You succeeded. You graduated from nursing school with passing grades. You learned a lot in school. You have been able to prove it with every quiz, midterm, and final examination you took in nursing school. Do you remember how many students were in your class during your first nursing course? Do you remember how the class thinned out and many students disappeared during the semester and all the semesters afterwards? Most of the students who left the nursing program left because they were not able to handle the rigors of school and studying, or they were not able to adapt and cope with the stressors associated with a highly difficult and challenging nursing program. You, however, did survive. Congratulations. You would never have been able to complete the nursing program and graduate without good grades and a superior knowledge about nursing, nursing care, and all the things you learned in nursing school. You have the knowledge to pass the Nclex PN examination, so you must go to the test with an I-can-do-it attitude of confidence. Vince Lombardi said, "The difference between a successful person and others is not a lack of strength, not a lack of knowledge, but rather a lack of will." What you must have on the day of your Nclex PN examination. In addition to your high level of confidence, you must also bring personal identification and limited personal items to the testing site. You must bring at least one form of personal identification to the testing center that has your name on it that exactly matches the name that you registered with, a recent photograph, and your signature. You will not be permitted to take the Nclex PN examination if the identification and your registration name are not an exact match. You will also have to begin and pay for the application process all over again in its entirety if the identification and your registration name are not an exact match, or the photograph does not look like you, or if your signature does not match that which is on the identification that you give to the test administrators. Some examples of personal identification that you can use for admission to the test can include a current driver's license, a passport, a state identification card, a military identification card, or a permanent resident card. You should also bring as few as possible personal items and possessions into the testing center. When you arrive at the testing center, you will be instructed to put all these possessions in a locker. You cannot bring any personal items into the test area. The testing center is not responsible for any losses, so we advise you to bring as little as possible into the testing center. The only things that you really need when you go to your testing center are your personal identification and your complete self-confidence. Checking in for your Nclex PN examination. Although you will not feel like you are checking into a world-class hotel, there still is a formal check-in process. It is strongly recommended that you arrive at least 1/2 hour before your scheduled testing time. If you are unsure of how you will drive to or get to the testing center, try a dry run several days before to test to determine how long it will actually take you to get there in the heaviest traffic. You may want to also explore alternative routes just in case your originally planned route is highly congested or closed off for one reason or another. The check-in process is done when you arrive. These are the things that will be done when you are checking in to take your test. You will present your valid and acceptable form of identification. You will then give your digital signature and your palm vein scan. Your photograph will then be taken by the testing site administrators. You will be asked to remove any outer clothing like a hat or a coat. You will have to remove all watches and other jewelry. The administrator will give you brief instructions and escort you to the computer that you will be assigned to. You may not leave this seat during the entire course of the examination unless you ask for and are given permission to leave this seat for a break. The rules of the Nclex PN examination. You must be 100% aware of and compliant with all the rules and regulations relating to taking your Nclex PN examination. A failure to comply with any rule is grounds for dismissal from the examination. Some of these rules will be discussed now. You are not permitted to access or retrieve any personal items from your locker during the entire time of the examination. This means that you cannot even get any personal items from your locker during breaks. You may not discuss any test questions with anyone at all. You cannot even try to reconstruct any test questions from your memory or the memory of others. You must not seek or accept the help of anyone during the examination. No cheating. You must not attempt to or take the Nclex PN examination for anyone else. You must not tamper with your assigned computer in any way. You must not use your assigned computer for anything other than the Nclex PN examination. You must not write on anything except the erasable noteboard you are given as you enter the testing area. You must raise your hand to ask the test administrator for a clean noteboard if you need it. You must return the noteboard when you leave the testing room. You can only use earphones and earplugs provided by the test administrator. You must raise your hand to ask the test administrator for a break. A palm vein scan will be taken when you leave the room for a break and again when you re-enter the testing room. You must raise your hand to ask for a break, to get a new and clean noteboard, to ask for a new computer if you think your computer is not working correctly, to alert the administrator that you are done with your examination, and for any other reason. The testing room. The room in which you will take your Nclex PN examination is completely unfamiliar to you, so now I will tell you a little bit about it so you will be more comfortable when you enter it. The room will be neat and sparse. The temperature of the room should be comfortable to you. It will be air-conditioned during warmer months of the year. It will be heated during the colder months of the year. For the most part, the room will be quiet because talking and carrying on conversations are prohibited. However, there can be extraneous sounds that will or may distract you. For example, you may hear a person cough, sneeze, drop something, or type an essay examination that some test takers may be required to do. The other people in the room may be taking other examinations administered by Pearson VUE. Not all the test takers are taking the Nclex PN examination. Some of these other test takers may have to type essay answers, which you may find distracting. If you think that you will be distracted with extraneous noises in the testing room, ask the test administrator for earplugs to block these noises. You may not use your own personal earplugs. You must use only the earplugs that are given to you by the test administrator. What will happen when you are done with your Nclex PN examination? When you are done with your Nclex PN examination, you will get a short questionnaire that will ask you about the experience that you had when checking in and throughout the duration of time that you were in the testing room. Raise your hand when you are done with this brief questionnaire. This will alert the test administrator that you are done with your Nclex PN examination. The test administrator will collect all of the items that were given to you, such as the noteboard. When this is done, you are free to leave. Take a deep breath and relax. You have done your best. The Nclex PN Test Plan. The Nclex PN Test Plan is organized into 4 major client needs categories. 2 of the 4 categories are divided into subcategories as shown below. 1. Safe and effective care environment. The subcategories are coordinated care and safety and infection control. 2. Health promotion and maintenance. 3. Psychosocial integrity. 4. Physiological integrity. The subcategories are basic care and comfort, pharmacological therapies, reduction of risk potential, and physiological adaptation. The distribution of 4 categories on the test. 1. Safe and effective care environment. This includes coordinated care 16% to 22% and safety and infection control 10% to 16%. 2. Health promotion and maintenance 7% to 13%. 3. Psychosocial integrity 8% to 14%. 4. Physiological integrity. This includes basic care and comfort 7% to 13%, pharmacological therapies 11% to 17%, reduction of risk potential 10% to 16%, and physiological adaptation 7% to 13%. A detailed look at the categories and subcategories on the Nclex PN examination. The safe and effective care environment. The 2 subsections under a safe and effective care environment are coordinated care and safety and infection control. Coordinated care. Coordinated care means the practical vocational nurse collaborates with healthcare team members to facilitate effective client care. Related content for the coordination of care includes, but is not limited to, advanced directives, advocacy, client care assignments, client rights, collaboration with interdisciplinary team, concepts of management and supervision, confidentiality, information security, continuity of care, establishing priorities, ethical practice, informed consent, information technology, legal responsibilities, performance improvement, quality improvement, referral process, and resource management. A sample question that could be included in the Management of Care section of the Safe and Effective Care Environment is: you are caring for a group of patients in a memory care unit of a long-term care facility. Which aspect of patient care can you assign to the certified nursing assistant who is working with you? A. Changing the patient's indwelling catheter bag and tubing. B. Obtaining a sterile urine sample from an indwelling catheter. C. Monitoring the flow rate of an intravenous solution. Or D. Orienting a patient to time, place, and person. The correct answer is D. Orienting a patient to time, place, and person. Certified nursing assistants are permitted to orient a patient to person, time, and place. They can also assist the client with their activities of daily living. Although nursing assistants can collect some specimens and laboratory samples, they are not permitted to collect any sterile samples. Nursing assistants are also not permitted to perform sterile tasks like changing the tubing and collection bags for indwelling urinary catheters. Lastly, only nurses can monitor and maintain intravenous flow rates. Safety and infection control. Safety and infection control requires that the practical vocational nurse contributes to the protection of clients and healthcare personnel from health and environmental hazards. Related content for the coordination of care includes, but is not limited to, accident, error, injury prevention, emergency response plan, ergonomic principles, handling hazardous and infectious materials, home safety, least restrictive restraints and safety devices, reporting of incident, event, irregular, occurrence variants, safe use of equipment, security plans, and standard precautions transmission-based precautions surgical asepsis. A sample question that could be included in the safety and infection control subsection of the safe and effective care environment is, which of these patients is at greatest risk for a medication error? A. An elderly patient with arthritis. B. A young adult affected with delirium. C. A middle-aged adult who is vomiting. Or D. An adolescent who abuses drugs. The correct answer is B. The young adult patient who is affected with delirium is most at risk for medication errors because this patient has impaired thinking and cognitive abilities. Although some elderly patients may be at risk for medication errors, arthritis is not the cause of this risk factor. A middle-aged client with vomiting and an adolescent who abuses drugs are not at risk for medication errors. However, they are at risk for other things, like an electrolyte disorder or a drug overdose, respectively. Health promotion and maintenance. In this section, the practical vocational nurse provides nursing care for clients that incorporates the knowledge of expected stages of growth and development and prevention and/or early detection of health problems. Related content includes, but is not limited to, aging process, ante, intra, postpartum, and newborn care, data collection techniques, developmental stages and transitions, health promotion, disease prevention, high-risk behaviors, lifestyle choices, and self-care. A sample question that could be included in the health promotion section of the examination is, which theory is used to determine the patient's level of psychosocial development? A. Piaget's theory. B. Maslow's theory. C. Erikson's theory. Or D. Freud's theory. The correct answer is C. Erik Erikson developed a psychosocial theory of development that covers the lifespan and all of its age groups and their related developmental tasks. Piaget developed the theory of cognitive development. Freud developed the psychosexual development theory. Maslow developed the hierarchy of human needs and not a theory of psychosocial development. Psychosocial integrity. In the psychosocial integrity part of your examination, you will be expected to provide care that assists with promotion and support of the emotional, mental, and social well-being of clients. Related content includes, but is not limited to, abuse or neglect, behavioral management, chemical and other dependencies, coping mechanisms, crisis intervention, cultural awareness, end-of-life concepts, mental health concepts, religious and spiritual influences on health, sensory perceptual alterations, stress management, support systems, therapeutic communication, and therapeutic environment. A sample question that could be included in the psychosocial integrity section of the Nclex examination is: you are taking care of a 9-year-old boy in a pediatric unit of the hospital. This boy was admitted with a severe upper respiratory infection and a high fever. You notice that this boy is wetting his pants and the bed. Which of the following is most likely the cause of this urinary incontinence when the patient was not incontinent prior to admission? A. Regression. B. Repression. C. The respiratory infection. Or D. The high fever. The correct answer is A. A child who begins wetting the bed and their clothing after they are toilet trained is most likely using regression. Regression is a psychological defense mechanism to protect the person from undue stress by returning to behaviors like urinary incontinence, which are characteristic of a far less stressful period of their life. Repression is also a psychological defense mechanism to protect the person from undue stress. However, repression involves the pushing of stressful feelings deep down and out of the person's consciousness. Respiratory infections and a high fever do not lead to incontinence. The 4 subsections under physiological integrity are basic care and comfort, pharmacological therapies, the reduction of risk potential, and physiological adaptation. Basic care and comfort. In the basic care and comfort questions, the practical vocational nurse will be required to demonstrate that they can provide comfort to clients and assistance in the performance of activities of daily living. Related content includes, but is not limited to, assistive devices, elimination, mobility-immobility, nutrition and oral hydration, personal hygiene, and rest and sleep. A sample question that could be included in the basic care and comfort subsection of the physiological integrity section is: which pain scale is used only for infants? A numeric scale from 1 to 10. B, the Flack scale. C, the Cries scale. Or D, the Faces pain scale. The correct answer is C. The pain scale that is used exclusively for infants is the Cries pain scale. Cries stands for C for crying, R for requires increased oxygen, I for increased vital signs, E for expressions of pain, S for sleepiness. Numeric pain scales from 1 to 10 are used only with older children and adults who are able to understand the meanings of numbers from 1 to 10. The Flack pain scale, which measures facial expressions, leg movements, activity level, crying, and consolability, can be used for infants. It can also be used for children up to about 3 years of age. The Faces pain scale is not used for infants. It is used among young children who can understand the meaning of happy and sorrowful faces. Pharmacological therapies. For the pharmacological therapies questions, the practical vocational nurse will demonstrate that they are able to provide care related to the administration of medications and are able to monitor clients who are receiving parenteral therapies. Related content includes, but is not limited to, adverse effects, contraindications, side effects, interactions, dosage calculations, expected actions, outcomes, medication administration, and pharmacological pain management. A sample question that could be included in the pharmacological therapy section of the physiological integrity section is: which is an example of a unique identifier? A, the patient's room and bed number. B, the patient's month and day of birth. C, the patient's doctor and the nursing care unit's name. Or D, a recent photograph of the patient. The correct answer is D. A recent photograph of the patient in their medical record is an example of a unique identifier that can be used to identify a patient before giving the patient any care or medications. The patient's room and bed number, the patient's month and day of birth without the year of birth, the doctor's name, and the nursing care unit's name are not unique identifiers because other patients can have these same identifiers. Reduction of risk potential. The reduction of risk potential questions will test the ability of the practical vocational nurse to reduce the potential for clients to develop complications or health problems related to treatments, procedures, or existing conditions. Related content includes, but is not limited to, changes, abnormalities in vital signs, diagnostic tests, laboratory values, potential for alterations in body systems, potential for complications of diagnostic tests, treatments, procedures, potential for complications from surgical procedures and health alterations, and therapeutic procedures. A sample question that could be included in the reduction of risk potential subsection of the physiological integrity section is: which complication of immobility can be prevented with the use of a sequential compression device? A. Urinary retention. B. The loss of bone calcium. C. Venous status. Or D. Renal calculi. The correct answer is C. The complication of immobility which can be prevented with the use of a sequential compression device is venous status. These devices promote venous return to prevent clots. These devices have no effect on the other complications of immobility, such as urinary retention, the loss of bone calcium, and renal calculi. Physiological adaptation. The physiological adaptation questions will test the ability of the licensed practical vocational nurse to participate in providing care for clients with acute, chronic, or life-threatening physical health conditions. Related content includes, but is not limited to, alteration in body systems, basic pathophysiology, fluid and electrolyte imbalances, medical emergencies, and unexpected response to therapies. A sample question that could be included in the physiological adaptation subsection of the physiological integrity section is: an example of a wound disruption is A. Dehiscence, B. Strangulation, C. Adhesions, or D. Infections. The correct answer is A. Dehiscence is an example of wound disruption. Another form of wound disruption is evisceration. Although adhesions and infection are complications of surgery and surgical wounds, they are not considered wound disruptions. Lastly, strangulation is the term that is often used to describe the abnormal anatomical positioning of an organ, such as the intestines. Integrated processes. The 4 integrated processes that are tested throughout the Nclex examination and fundamental to the practice of practical vocational nursing are the nursing process, which is also referred to as the clinical problem-solving process, caring, communication and documentation, and teaching and learning. The nursing process, or the clinical problem-solving process, which is defined as the scientific approach to client care that includes data collection, planning, implementation, and evaluation. 2. Caring, which is defined as the interaction of the practical vocational nurse and client in an atmosphere of mutual respect and trust. In this collaborative environment, the practical vocational nurse provides support and compassion to help achieve desired therapeutic outcomes. 3. Communication and documentation, which are defined as verbal and nonverbal interactions between the practical vocational nurse and the client, as well as other members of the healthcare team. Events and activities associated with client care are validated in written and/or electronic records that reflect standards of practice and accountability in the provision of care. 4. Teaching and learning, which are defined as the facilitation of the acquisition of knowledge, skills, and attitudes to assist in promoting a change in behavior. Welcome to the first integrated process, which is the clinical problem-solving process and the nursing process. Although many aspects of nursing and the knowledge needed for both registered nurses and licensed practical nurses are similar, there are also some major differences. The clinical problem-solving process and the nursing process is one of these major differences. Licensed practical nurses use the clinical problem-solving process to guide their thinking and problem-solving. Registered nurses use the nursing process to guide their thinking and their problem-solving when it comes to patient care. The clinical problem-solving process is a scientific process that includes data collection, planning, implementation, and evaluation. On the other hand, the nursing process is a scientific, dynamic, and cyclical process that includes assessment, data analysis, diagnosis, planning, implementation, and evaluation. Although both the registered nurse and the licensed practical nurse both have planning, implementation, and evaluation in their scientific methods of providing patient care, the specific roles of the registered nurse and the licensed practical nurse in these areas are also different. The clinical problem-solving process and the roles of the licensed practical nurse. The steps of the clinical problem-solving process are 1. Data collection, 2. Planning, 3. Implementation, and 4. Evaluation. Data collection. Data collection includes the nurse's observations and collection of information about the individual patient and their needs. This data can be categorized in several ways. Data can be primary or secondary data. Data can also be objective or subjective. Data can be categorized as qualitative or quantitative. Data can also be classified as current and historical. Primary data is data that is collected from the patient themselves. Secondary data is data that is collected from things other than the patient. The patient's vital signs, the patient's complaints of pain, and the patient's level of balance are examples of primary data. Examples of secondary data include things like laboratory results, the results of X-rays, and information that is told to the nurse by others like family members. Objective data is data that you can directly observe with your senses, like your sense of vision, hearing, touch, and feel. For example, the patient's temperature, the patient's blood pressure, and the patient's pulses are objective data because you can see the patient's temperature on a thermometer, you can hear and see a patient's blood pressure using a blood pressure machine, and you can feel a pulse using your fingertips. Subjective data, on the other hand, is not observable with the senses. Subjective data is data that the patient tells you. Subjective data is collected and recorded using the exact words of the patient in quotation marks. For example, quote, "I am not at all hungry today," end quote, and, quote, "I have a headache," end quote, are examples of subjective data. Nurses also collect data that can be qualitative or quantitative. Qualitative data consists of words, and quantitative data consists of numbers. Examples of quantitative data are vital signs and laboratory values. Examples of qualitative data include the interpretation of X-rays and a narrative patient's past medical history. Lastly, data can be old or historical, and it can also be current or new. Historical data, like that contained in an old medical record, gives healthcare providers some information about the patient's past medical problems. Current data gives us up-to-date data and information about the patient's current medical status. Data is collected in reference to the physical or biological, psychological or emotional, social, spiritual, and cultural characteristics and needs for the whole or holistic client in their environment. Planning. Licensed practical nurses plan care for patients in collaboration with other members of the healthcare team, like the registered nurse and dietitians, for example. The purpose of planning is to establish priorities of care, to determine what the patient's expected outcomes of care should be, and to determine the interventions, including nursing interventions, that should be given to the patient to achieve these expected outcomes. Expected outcomes are based on the patient's needs and the data that was collected during the data collection phase of the clinical problem-solving process. Most healthcare facilities document this plan of care on a nursing care plan form so that all healthcare providers have access to it so they can follow it. Implementation. Licensed practical nurses render care to the patient and document it during the implementation phase of the clinical problem-solving process. Care is given and implemented according to the plan of care, the particular healthcare facility's policies and procedures, the nurse's job description, their level of competency, and the scope of practice for the licensed practical nurse. For example, some healthcare facilities allow licensed practical nurses to start and manage intravenous fluids, and others do not. Some job descriptions for the licensed practical nurse allow the nurse to start an intravenous line, and others do not. Some licensed practical nurses have been deemed competent by the registered nurse to change intravenous catheter dressings, and others have not been deemed competent to do so. Lastly, licensed practical nurses must follow the scope of practice for their state. When a licensed practical nurse does things that are not included in their legal state's scope of practice, they are practicing nursing outside of their scope of practice. Practicing nurses outside of the scope of practice can be punished with suspension or revocation of the nurse's license to practice nursing. Licensed practical nurses must deliver high-quality, competent care to patients that is consistent with their healthcare facility's policies and procedures, their job description, their level of competency, and the scope of practice for their licensed practical nurse. Evaluation. The licensed practical nurse also evaluates the outcomes of care. They determine whether or not the care has produced the expected responses. For example, the licensed practical nurse monitors the patient's level of pain in about 1 hour after administering an ordered pain medication. Then, they will compare the patient's current level of pain to the reported level of pain before the medication was administered. Did the patient's level of pain decrease, increase, or remain the same? Now, let's do a couple of sample questions for the clinical problem-solving process and the roles of the licensed practical nurse. Question 1. Your patient tells you that they are, quote, very upset about having to have surgery, end quote. What kind of data is this? A. Historical data. B. Subjective data. C. Secondary data. Or D. Objective data. The correct answer is B. Subjective data. When the patient tells you that they are, quote, very upset about having to have surgery, end quote, they are providing you with subjective data that cannot, like objective data, be observed and measured. Historical data is old data and not current like this patient's statement. Lastly, secondary data comes from a source, like a spouse or a part of the medical record, rather than from the patient themselves. Now, let's try another question. Which phase of the clinical problem-solving process requires the consideration of the scope of practice for the licensed practical vocational nurse? A. Data collection. B. Planning. C. Implementation. Or D. Evaluation. The correct answer is C. The implementation phase. The state scope of practice for the licensed practical vocational nurse is considered during the implementation phase of the clinical problem-solving process. The scope of practice outlines what the licensed practical vocational nurse can and cannot do in terms of their implementation of patient care. Data collection, participation in the planning process, and evaluating the patient's responses to care are not associated with the nurse's legal scope of practice. The 6 stages or phases of the nursing process are 1. Assessment. 2. Data analysis. 3. Diagnosing. 4. Planning. 5. Implementation. And 6. Evaluation. Assessment. The registered nurse assesses individuals, groups like families, and the local as well as global community to determine their healthcare needs. Assessment data is collected in collaboration with the licensed practical nurse and other members of the healthcare team. This data is then organized, validated with the client and others, and finally documented by the registered nurse. As stated previously, this data can include primary, secondary, subjective, objective, qualitative, quantitative, historical, and current data and information. Some of the data that is particular to the role of the registered nurse when compared and contrasted to the licensed practical nurse includes a complete and thorough head-to-toe physical assessment and a complete and thorough history, which includes the current and past medical history. Again, data is collected in reference to the physical or biological, psychological or emotional, social, spiritual, and cultural characteristics and needs for the whole or holistic client in their environment. Data analysis. Data analysis is the responsibility of the registered nurse rather than the licensed practical nurse. The organization and analysis of data requires the critical thinking and professional judgment skills of the registered nurse. Data is analyzed using the knowledge, skills, abilities, and inductive and deductive reasoning of the registered nurse, often in collaboration with other members of the healthcare team. For example, if the patient data includes patient vomiting, diarrhea, poor fluid intake, scant urinary output, dry mucous membranes, orthostatic hypotension, and confusion, the registered nurse would use their professional judgment, critical thinking, and reasoning skills to conclude that the patient is probably dehydrated. Diagnosing. The generation of nursing diagnoses after assessment and data analysis is also the sole responsibility of the registered nurse according to the state's scope of practice for the registered nurse. Nursing diagnoses are different from medical diagnoses. Nursing diagnoses identify actual and potential healthcare problems. There are several types of nursing diagnoses, including actual diagnoses, risk diagnoses, wellness diagnoses, possible nursing diagnoses, and syndrome nursing diagnoses. An example of an actual nursing diagnosis is acute pain related to. An example of a risk nursing diagnosis is at risk for skin breakdown related to. An example of a wellness nursing diagnosis is readiness for enhanced self-care related to diabetes management. An example of a possible nursing diagnosis is potential for an ineffective infant feeding pattern related to. Lastly, an example of a syndrome nursing diagnosis is risk for disuse syndrome related to. Nursing diagnoses consists of a problem, a qualifier, an etiology, and defining characteristics. For example, in the nursing diagnosis, acute and severe pain related to muscular spasms as evidenced by self-reports of pain, the problem is pain. The qualifiers are acute and severe. The etiology or cause of the pain is muscular spasms. The defining characteristic is as evidenced by self-reports of pain. Other examples of qualifiers for nursing diagnoses are chronic, decreased, increased, ineffective, disturbed, imbalanced, and compromised. Planning. As previously mentioned, the purpose of planning is to establish priorities of care, to determine what the patient's expected outcomes of care should be, and to determine the interventions that should be given to the patient to achieve these expected outcomes as based on the patient's needs and the data that was collected during the assessment, the analyzing, and the nursing diagnosis phase of the nursing process. The different types of planning are initial planning, which should begin with the first patient contact, ongoing planning during the course of care, and discharge or transfer planning, which are done using current patient data. Priority setting. Priorities are established using a number of methods and frameworks, including the ABCs, Maslow's hierarchy of needs, and the ABCs/MAAUAR method. The ABCs identify the airway, breathing, and cardiovascular status of the patient as the highest of all priorities in that sequential order. Maslow's hierarchy of needs identifies the psychological or biological needs, including the ABCs, the safety, psychological, emotional needs, the need for love and belonging, the needs for self-esteem and esteem by others, and the self-actualization needs in that order of priority. Lastly, The ABC/MAAUAR method places the ABCs again as the highest and greatest priorities. This is then followed with the second and third priority level needs. The second priority needs include MAAUAR, which stands for mental status changes and alterations, acute pain, acute urinary elimination concerns, unaddressed and untreated problems that require immediate priority attention, abnormal laboratory and other diagnostic data, and risks including those relating to a healthcare problem like safety, skin breakdown, infection, and other medical conditions. The third level priorities include all concerns and problems not covered under the second level priority needs. For example, enhanced self-care and increased knowledge are considered second level priority needs. Expected outcomes of care. Expected outcomes of care are based on the data collected, data analysis, nursing diagnoses, and priority of care. The purpose of expected outcomes is to allow the nurse to determine and measure whether or not the care that was provided has been effective in terms of solving the patient's healthcare problem. For this reason, all expected patient outcomes must be specific and not vague or ambiguous. Expected outcomes, also referred to as patient goals, must be specific, measurable, achievable, realistic, within a time frame, trackable, and agreed to by the patient and in terms of the patient and not the nurse or other healthcare provider. Some nurses remember these characteristics of expected outcomes using SMARTA, which represents specific, measurable, achievable, realistic, time-framed, trackable, and agreed to. A good, useful, complete expected outcome should be: the patient will select appropriate attire each morning according to their planned activities and the environmental temperature. This expected outcome is in terms of the patient. It states, the patient will. It is specific. It states, select appropriate attire and according to the planned activities and the environmental temperature. It is within a time frame. It states, every morning, and it is also observable and measurable and able to be tracked each day over time. Other requirements for an expected outcome include the subject, the verb, the conditions, and the patient's performance criteria. Using the same expected outcome, that is, the patient will select appropriate attire each morning according to their planned activities and the environmental temperature. The subject of the statement is the patient. The verb is select. The conditions include according to their planned activities and the environmental temperature. The performance criteria is appropriate. Planning interventions. Interventions are planned according to the assessment data, the analysis of the data, the nursing diagnoses, the priorities of care, and the expected outcomes of that care. Nurses, including licensed practical nurses, perform independent and dependent nursing interventions. Independent nursing interventions are those things that nurses can provide to the patient without a doctor's order. Dependent nursing interventions are those things that nurses can provide to the patient only with a doctor's order. A dependent nursing intervention is the administration of medication, which can only be done with a complete doctor's order. Independent nursing interventions include things like turning the patient, positioning the patient, and assisting with the patient's activities of daily living, which can be done without a doctor's order. Implementation. Registered nurses, like licensed practical nurses, render care to the patient and document it during the implementation phase of the nursing process. Similar to the role of the licensed practical nurse, care is given and implemented according to the plan of care, the particular healthcare facility's policies and procedures, the nurse's job description, their level of competency, and their scope of practice. Evaluation. The registered nurse, like the licensed practical nurse, also evaluates the outcome of care. They determine whether or not the care has produced the expected response or responses by the patient. The process of evaluation is done by collecting data related to the expected outcome, analyzing the data, comparing this analyzed data to the data collected prior to the current time, and making a decision about whether or not the goals were completely, partially, or not met at all. Although the licensed practical nurse can collect evaluation data, as they do with data collection phase of the critical problem-solving process, it is the registered nurse who is accountable for the analysis of this data. The registered nurse is also responsible for the formal evaluation process and the modifications to the plan of care if indicated by this goal achievement or lack thereof. Now, let's do a couple of sample questions for the nursing process and the roles of the registered nurse. Question 1. Which phase of the nursing process is not within the scope of practice for the licensed practical nurse? A. The collection phase. B. The data analysis phase. C. The implementation phase. Or D. The evaluation phase. The correct answer is B. The data analysis phase. The data analysis phase of the nursing process is not within the scope of practice for the licensed practical nurse. Data analysis is exclusively within the scope of practice for registered nurses. Data collection, implementation, and evaluation are within the scopes of practice for both the licensed practical nurse and the registered nurse. However, as previously discussed, there are some differences. Now, let's do another question. Which of the following is a complete and appropriate nursing diagnosis for a patient who was admitted with a high fever of unknown origin? A. The client will be free of complications such as dehydration. B. The nurse will monitor the patient's vital signs Q4H. C. At risk for impaired fluid balance related to dehydration. Or D. At risk for impaired fluid balance related to the febrile state. The correct answer is D. At risk for impaired fluid balance related to the febrile state. At risk for impaired fluid balance related to the febrile state is a complete and appropriate nursing diagnosis for a patient who is affected with a fever of unknown origin. This at-risk nursing diagnosis consists of a qualifier, which is impaired, a problem, which is fluid balance, and an etiology, which is a fever of unknown origin. The client will be free of complications such as dehydration is an expected patient outcome and not a nursing diagnosis. The nurse will monitor the patient's vital signs Q4H is a nursing intervention. At risk for impaired fluid balance related to dehydration is not appropriate for this patient because the etiology is the fever and not dehydration. Welcome to the second of 4 integrated processes, which is caring. Caring is defined as the interaction of the practical vocational nurse and client in an atmosphere of mutual respect and trust. In this collaborative environment, the practical vocational nurse provides support and compassion to help achieve desired therapeutic outcomes. Caring and compassion are universal elements of all aspects of nursing care in all settings for individuals, significant others, families, populations, and communities. Some of the concepts related to caring and their definitions will now be discussed. Caring is an intentional action that conveys physical and emotional security and genuine connectedness with another person or group of people. Berman and Snyder, 2012. Compassion is defined as one's feelings that you want to decrease and alleviate another's pain and suffering when you become aware of it. Empathy is the ability to discriminate what the other person's world is like and to communicate to the other this understanding in a way that shows that the helper understands the client's feelings and the behavior and experience underlying these feelings. Berman and Snyder, 2012. Sympathy is defined as feelings of compassion that prompt action, but, unlike empathy, sympathy does not include having the same shared feelings. Altruism is the thoughtful and selfless actions that are taken when a person is motivated with compassion and the need to decrease and alleviate another's pain and suffering. Gene Watson, who developed the human caring theory, states that caring is the essence of nursing. According to Gene Watson, the 10 nursing interventions that show and demonstrate genuine caring are: developing a helping and trusting relationship, promoting expressions of positive and negative feelings, using problem solving for decision making, promoting transpersonal teaching and learning, assisting with the gratification of biophysical and psychosocial human needs, forming a humanistic and altruistic value system, instilling faith and hope, cultivating a sensitivity to self and others, providing and maintaining a supportive, protective, mental, physical, societal, and spiritual environment, and allowing for existential, phenomenological spiritual forces. Now, I will give you some questions about caring. Which emotion entails sharing the same feelings as another? A. Sympathy. B. Empathy. C. Caring. Or D. Compassion. The correct answer is B. Empathy. Empathy entails sharing the same feelings as another. Sympathy is a feeling of compassion that prompts action but does not include having the same shared feelings. Caring is an intentional action that conveys physical and emotional security and genuine connectedness with another person or group of people. Berman and Schneider, 2012. Compassion is defined as one's feelings that you want to decrease and alleviate another's pain and suffering when you become aware of it. Now here is another practice question. Whose theory describes caring? A. Gene Watson. B. Dorothea Orem. C. Madeline Leiniger. Or D. Martha Rogers. The correct answer is A. Gene Watson. Gene Watson developed the human caring theory. Dorothea Orem developed the self-care theory. Madeline Leiniger developed the transcultural nursing theory. Martha Rogers developed the theory of unitary man. Welcome now to the third of 4 integrated processes, which is communication and documentation. Communication and documentation are defined as verbal and nonverbal interactions between the practical vocational nurse and the client, as well as other members of the healthcare team. Events and activities associated with client care are validated in written and/or electronic records that reflect standards of practice and accountability in the provision of care. The purpose of communication and documentation is to convey a message to another person or a group of people. Communication. Communication is defined as an interactive process that transmits some message, meaning, information, emotions, and/or beliefs to another person or a group of people. It establishes and maintains connectedness between and among human beings. Communication can be written, verbal, nonverbal body language, and in a graphic or pictorial way. An example of verbal communication is talking with a patient about the treatment that you will be giving them. An example of written communication is the documentation of medications administered so that others, including other nurses, know that any ordered medications have indeed been given according to the doctor's order. An example of nonverbal body language is tapping one's foot in the presence of a patient, which conveys a message that the nurse is impatient. Graphic and pictorial communication is the primary purpose of art and artwork. Art and music are universal ways of communicating message or feeling without the use of words or writing. Nurses often use pictures and diagrams to communicate a message to a patient, particularly when they are non-English speaking and/or they are not able to verbally send and receive messages. The components of communication. Regardless of the type of communication, all communication consists of several essential components. These components are the sender of the message itself, the receiver of the message, and the response or feedback that occurs. The sender transmits and conveys the message to others. The receiver is the person who gets the message from the sender. The message is the information or emotion that is being conveyed or sent to another. The feedback is the response of the receiver to the message. For example, when the sender of the message gently touches the shoulder of a patient to convey caring and compassion, the receiver of the message, who is the patient, decodes this message as a feeling of caring and compassion. The patient then acknowledges these feelings verbally or non-verbally, and then sends this message of acknowledgement back to the other person. Notice that, in this example, the receiver of the message becomes the sender of the message when they respond back to the person who was the original sender of the message. This feedback allows the nurse to acknowledge that the message was received and to respond to the message. Factors that impact on and affect communication. Many factors impact and affect communication. Some of these factors are beneficial to this dynamic, interactive process, and others are barriers to effective communication. At all times, nurses must overcome barriers to communication when they exist. Communication with the patient and/or significant other is essential to nursing and the provision of patient care. Factors that impact communication include level of development and age, level of consciousness, emotional state and level of stress, language spoken, the nature of the relationships between and among people involved in the communication process, individual values, beliefs, and perceptions, culture, past experiences, and the environment itself. The level of development and age impact on communications. For example, nurses communicate with neonates and infants with touch and a soft, soothing voice. Levels of consciousness and levels of awareness enhance the communication process when it is normal, but it hampers communication when the patient has a decreased level of consciousness and awareness. High levels of stress and the presence of other stressors, such as pain, can be a barrier to effective communication. Language and language skills, including vocabulary and reading skills, can also impede communication. Accommodations, like the use of a professional translator, may be necessary for some patients when they do not communicate in English. The nature of the relationships between and among people involved in the communication process affects the communication process in many ways. For example, figures who are perceived as in a position of power and influence, like nurses and doctors, may impact on the openness of the patient who does not view themselves as an equal in the nurse-patient relationship. Not only does culture impact a person's values, beliefs, opinions, and perspectives, culture also influences the person's use of terms and terminology, as well as their perceptions of nonverbal messages. For example, some cultures view eye contact, touch, and proxemics, which is the distance between people, differently than others who are outside of the culture. Some view touch as invasive and not caring. Some view eye contact as a sign of honesty. Others may view eye contact as aggressive and hostile. Still more have different tolerances for various distances between them and the person they are communicating with. We will discuss these personal spaces and proxemics later. Past experiences impact the way many people communicate with others. For example, when a patient has been shunned in the past for expressing their true feelings of depression, for example, the person will be reluctant to discussing these feelings in the future. Lastly, the physical environment and the tenor of the environment also impact on communication. For example, a calm, open, trusting environment at a comfortable temperature is conducive to communication and conversations. Verbal communication. Verbal communication consists of words and sounds. When compared and contrasted to nonverbal communication, verbal communication is far more consciously controlled and often less ambiguous than nonverbal communication. People simultaneously communicate with both verbal and nonverbal communication. At times, The messages conveyed with the verbal communication are consistent with the messages conveyed by nonverbal communication. However, this is often not the case. At times, the verbal and nonverbal messages do not match. For example, when a nurse stands in a patient's doorway with their arms crossed and their foot tapping on the floor while asking the patient why they seem to be upset, the verbal message conveys and communicates caring and compassion. However, the nonverbal foot tapping and crossed arms conveys and sends a message that the nurse is impatient, in a hurry, and really not wanting the patient to tell the nurse why they are upset. The tone of the voice, the speed or pace of the communication, the brevity, simplicity, the use of pauses, and the clarity of the message affect the communication and the communication process among and between people. For example, effective communication with a hostile patient should be done with a soft, calming voice that may de-escalate the patient's level of hostility. Communicating with brief and clear messages often facilitates nurses' effective communication with confused and lethargic patients. Pauses during a conversation, when not lengthy in duration, are helpful because it gives the sender and receiver of the verbal message time to think about the message and its meaning. However, lengthy pauses can be very uncomfortable at times. Sounds are a form of verbal communication. When compared and contrasted to words, sounds are often more difficult to interpret. For example, a grunt may indicate a number of things, including the presence of pain, restlessness, and exasperation. For this reason, nurses should communicate with the patient to clarify the meaning of their sounds. In summary, verbal communications must be modified according to the needs of the patient and their level of understanding with an open, honest, and non-judgmental and professional environment. Nonverbal communication. As previously mentioned, nonverbal communication is very often out of the conscious control of the sender of these nonverbal messages. Nonverbal communication also transmits feelings and emotions which, unlike verbal communication, can communicate emotions. Nonverbal communication is also not as clear and unambiguous as verbal communication is. Nonverbal communication conveys a message with bodily movements, facial expressions, gestures, touch, the use of space and distance, eye movements and eye contact, bodily posture, and one's personal appearance. For example, eye movement and eye contact can convey a number of emotions. Eye contact can convey honesty, caring, and interest during communication. The lack of eye contact can convey that that person is dishonest, nervous, and even with a low level of self-esteem. Also, communication at eye level with the patient conveys the message that the nurse and the patient are equals in the nurse-patient relationship. Facial expressions convey a wide variety of emotions, including sorrow, joy, boredom, and pain. A lack of facial expression, which is referred to as a flat effect, communicates a lack of interest and/or the presence of a psychological problem. Proxemics and territoriality. Proxemics is the use of personal spaces during the communication process. Although individuals and some cultures may differ in terms of their use and tolerance of different personal spaces, most Americans have these spatial distances. The intimate zone. This zone ranges from direct bodily contact to 1.5 feet away from the body's surface. The personal zone. This zone begins 1.5 feet from the body to 4 feet away from the body. The social zone. This zone goes from 4 feet away from the person to 12 feet away from the person. And the public zone. This zone is defined as 12 or more feet from the person. The intimate zone is typically reserved for intimate partners. However, the intimate zone is often invaded by nurses and other healthcare providers as they care for patients. For example, the intimate zone is invaded when a nurse gives a caring touch to a patient, when a urinary catheter is inserted, when perineal care and bathing is provided, and when the patient is turned and positioned in bed. Many patients become overwhelmed and uncomfortable when their intimate zone and/or their personal zone is invaded. Therefore, nurses and other members of the healthcare team must always explain procedures to the patient before rendering care. Nurses and other members of the healthcare team must also provide the patient with as much personal privacy as possible during the provision of care. Territoriality is the connection of possessions and things with a person. Feelings of territoriality and the need to protect one's territory is part of human nature. People protect their territories in their home and in their healthcare facilities. For example, a patient may feel that their room in the hospital is their territory. They may feel the need to protect it. Nurses, therefore, must knock on the door and get permission to enter from the patient. They should also ask the patient for permission before moving and rearranging things in the bedside area. The therapeutic relationship and therapeutic communication. The therapeutic nurse-patient relationship begins with the establishment of trust, after which this relationship matures to an effective one that employs proper therapeutic communication techniques. Some of these therapeutic communication techniques are attentive, active listening. Although many do not immediately recognize the fact that listening is an essential part of communication, it is. Attentive listening is far more than hearing. Attentive listening involves active listening, and it is not a passive activity. Silence. Like listening, many do not realize that silence is a useful part of communication. Silence allows the sender and the receiver of the conveyed message to think about the received message. They can then contemplate the best response or feedback to the other person relating to the message. When silence is prolonged, however, it may make some feel uncomfortable and/or that there is no interest in the conversation by the other. Reflection. This form of therapeutic communication mirrors or reflects the patient's feelings, not words, back to the patients so that these feelings can be further explored and expressed by the patient. For example, when the nurse states, "You seem very stressed today," the patient will be likely to tell the nurse why they are upset. Focusing. This therapeutic communication technique allows the patient to remain focused on the subject at hand rather than becoming distracted and disorganized in terms of the conversation. For example, the nurse may say, "Mr. Jones, we will talk about the diabetic diet in a little while, but now let's discuss your blood glucose results over the last month." Paraphrasing and restating. Restating and paraphrasing allows the nurse to acknowledge that they have a good understanding of what the patient has said and meant in their sent message. An example of paraphrasing and restating is, "I heard you state that you were going to agree to the surgery for next week." The clarification of received messages. Received messages are always clarified and validated with patients to ensure that the nurse has received and interpreted the complete and correct message without any errors or false assumptions. Nurses can clarify patient messages by asking the client a question like, "Am I correct that you told me you plan on having the surgery done next week?" Providing leads to the patient. Providing the patient with a lead facilitates the patient's open expression of feelings, concerns, and messages. Providing a lead like, "Tell me a little more about your concerns relating to your surgery next week," will promote and facilitate the patient's communication with the nurse. Summarizing. Summarizing is highly useful to sum up the main points of the nurse-client interactive discussion and also to further validate that messages sent and received were interpreted correctly. For example, the nurse may state, "During this conversation, we talked about your blood glucose readings and specific ways, including dietary choices, that you can lower your blood glucose levels." Ineffective communication. Some of the things that can impede effective therapeutic communication include making judgments, stereotyping and assuming that all people in one group or another have the same opinions, beliefs, or practices, changing the subject or topic of conversation, challenging, probing, and being defensive during communication. Overcoming barriers to effective communication. Nurses are responsible for effective communication with patients. In order to fulfill this responsibility, nurses must immediately identify any barriers to communication and then overcome these barriers with effective strategies. For example, the nurse will use simple terms and make discussions brief when a patient is in pain or confused. The nurse will modify their terminology and vocabulary when they are communicating with a young child, for example. The nurse will also use therapeutic touch when a patient is upset or sorrowful. Documentation. Like verbal and nonverbal communication, documentation is used to transmit and convey messages in writing. In fact, the primary purpose of documentation is communication. Other purposes of documentation include meeting the legal mandates relating to Medicare's conditions of participation, using documentation for reimbursement and also to meet the regulatory requirements of the states, and to fulfill the recommendations and standards put forth by other regulatory bodies, such as the Joint Commission on the Accreditation of Healthcare Organizations. Some forms of documentation in the healthcare environment are the medical record, care plans, employee schedules and time cards, policies and procedures, minutes of meetings, interoffice letters and messages, and emails. Medical record documentation. All medical records and all parts of it are legal documents. The legal nature of documentation applies to hard copy and electronic versions of the medical record. In order to be effective, documentation must be complete, timely, accurate, and professional. It must reflect all patient care, data, and information. It must be done in a timely manner and according to the policies and procedures of the healthcare facility and other legal or regulatory requirements. It must be without errors. It also must be professional, legible, clear, understandable, and without any ambiguity. Complete, timely, accurate, and professional documentation prevents errors of commission and omission. It avoids unnecessary delays in treatment and care. It facilitates the highest possible quality of care for the patient. Most documentation errors are errors of omission. The nurse or another healthcare provider neglects and/or fails to document something that should have been documented. Errors of commission can also occur. For example, the certified nursing assistant or nurse who records incorrect vital signs in the patient's medical record has made an error of commission relating to documentation. All documentation errors have the potential to lead to serious and severe patient effects, including death. Approved and acceptable abbreviations and terminology. A multitude of abbreviations can be differently interpreted among healthcare providers. Therefore, the Joint Commission on the Accreditation of Healthcare Organizations and common sense mandates that only accepted and approved abbreviations and terminology are used for documentation. For example, the abbreviation MS is not an approved abbreviation because MS can be interpreted as multiple sclerosis, morphine sulfate, and magnesium sulfate. All healthcare facilities are required to have a formalized list of unacceptable abbreviations that cannot be used because they are problematic and can lead to errors and confusion. Some of the abbreviations that are no longer used include MS, MS-04, MG-S-04, U for unit, IU for international unit, QD for once daily, QOD for every other day, a trailing zero like 9.20 milligrams, the lack of leading zero like 0.1, HS. The legal aspects of documentation and documents. Some of the legal aspects of documentation include the prohibitions against altering a record, obliterating entries in the medical record, and falsifying documentation. Medical documents are protected as confidential records. Sharing or accessing patient information is prohibited except when this sharing and accessing is necessary to provide care to the patient. Types of medical records and documentation. All types of medical records and documentation systems have advantages and disadvantages. Healthcare facilities select the types of medical records and documentation systems that they use. The most commonly employed types of medical records are the source-oriented medical record, focused charting, charting by exception, the problem-oriented medical record, and critical pathways. The source-oriented medical records. The source-oriented medical record is the oldest kind of medical record documentation. The source-oriented medical record is typically kept in a binder or a metal flip chart with dividers that are labeled with the contents of each section. For example, nursing, laboratory, physical therapy, and medical doctors each have a separate section in the source-oriented medical record for their own documentation. This discipline-specific chart typically includes flow sheets, vital sign graphic charts, progress notes, and other forms of documentation such as the medication record, doctor's order sheets, the medical history and physical, the nursing admission assessment, and a standardized patient teaching form or record. Some of the advantages of the source-oriented medical record include the fact that it is highly familiar to healthcare providers, it is relatively simple to use, and the progress notes are typically free-flow narrative notes that do not require a special format like other systems, such as the problem-oriented medical record. Some of the disadvantages of the source-oriented medical record include the fact that they are not multidisciplinary in nature and the fact that the patient information is scattered all over the medical record. Focused charting. Focused charting is less commonly encountered than other documentation systems. Focused charting makes patient-related issues like the patient's problems, the patient's strengths, the patient's nursing diagnosis, and changes in the patient's condition the focus of the medical record. The progress note for focus charting is done on a 3-column form that includes the date and time of the entry, the focus or patient-related issue, and the progress note that is done in the DAR format. DAR stands for Data, Action, and Response. Data is assessment data. Action is what is done to solve the patient problem or concern. Response reflects the evaluation of the patient after the intervention. Date: November 27, 2015. Focus: acute pain secondary to abdominal surgery. DAR progress note. D. The patient reports a pain level of 8 out of 10. A. The patient was given the ordered morphine sulfate 2 mg. R. The patient reports their level of pain at 4 out of 10 a half hour after the PRN medication. An advantage of focus charting includes the fact that it is relatively simple to use. Its disadvantages are similar to those of the source-oriented medical record. That is, focus charting is not multidisciplinary in nature, and the patient information is scattered all over the medical record. Charting by exception. Charting by exception is based on the principle that only abnormal and significant things have to be recorded and documented. This method is rarely used because it has some serious disadvantages. The charting by exception method employs flow sheets of all types, references to established standards of nursing care, and a narrative nursing progress note which only includes significant and/or abnormal data and information. The advantage of this method is that it significantly decreases the length of the progress notes because only abnormal and significant data and information are documented. The perils and pitfalls of charting by exception, however, can potentially jeopardize patients because with this system, it is assumed that all exceptions have been charted and documented. The reality is, many nurses and other healthcare providers simply forget to chart and document as they should. When documentation is not done, a person can assume that, for example, the patient's vital signs were normal when, in fact, they were not. The problem-oriented medical record. The problem-oriented medical record is very distinct from the source-oriented medical record and other documentation systems. The problem-oriented medical record is multidisciplinary. Instead of patient information being spread throughout the medical record for each discipline like nursing and physical therapy, the patient's information and data is organized and clustered according to the patient's problems. All members of the healthcare team, including the doctors, nurses, and others, collaboratively develop, maintain, and compile a complete list of patient problems. Each of the disciplines in the multidisciplinary team then provide and document the care and services that they provide in reference to one or more of these patient problems. This method of documentation consists of a patient database, a formalized list of problems that is typically placed in the front of the patient's medical record for rapid reference, a plan of care, and uniquely done patient progress notes that are also multidisciplinary. The database section includes assessment data like the medical history and physical, the nursing assessment, and other information. The problem list, as based on the patient's current assessments and condition, includes biopsychosocial, cultural, spiritual, and educational needs. Medical doctors typically write problems during the patient's medical diagnosis, such as COPD. Nurses typically record patient problems using a nursing diagnosis, such as at risk for impaired skin integrity related to immobility. The plan of care is also generated by all the disciplines in the healthcare team. It, too, is directly aligned with the established problem list. As with all other documentation systems, ongoing assessments, modifications of the problem list, and changes in the plan of care are done in an ongoing manner according to the changing status and needs of the patient. The progress notes for the problem-oriented medical record are also multidisciplinary. Instead of free-flowing narrative progress notes, these progress notes are highly structured, goal-directed, and organized according to the patient problems. For example, if a patient problem is a cerebrovascular accident, the progress notes are labeled with a specific problem number and label. The format of the progress notes is one of the following as decided upon the particular healthcare agency. It can be SOAP, SOAPIE, or SOAPIER. A SOAP progress note for problem number 1, at risk for impaired skin integrity related to immobility, may appear like this. S for subjective data. The patient states that they, quote, are turning themselves in bed, end quote. O for objective data. The patient's skin is dry and intact. A for assessment. Intact skin. P for planning. Encourage out-of-bed activity and continue to monitor the condition of the skin. The SOAPIE progress note for problem number 2, COPD, can be composed like this. S for subjective data. Quote, I am breathing better after my treatment, end quote. O for objective data. Decreased pallor and cyanosis. A for assessment. Improved arterial blood gases. P for planning. Continue the plan of care. I for interventions. Monitor the client and administer respiratory medications and treatments. E for evaluation. Respiratory medications and treatments are effective. The SOAPIER progress note for problem number 2, COPD, can be composed like this. S for subjective data. Quote, I am breathing better after my treatment, end quote. O for objective data. Decreased pallor and cyanosis. A for assessment. Improved arterial blood gases. P for planning. Continue the plan of care. I for intervention. Monitor the client and administer respiratory medications and treatments. E for evaluation. Respiratory medications and treatments are effective. R for revisions. Encourage increased activity. The advantages of the problem-oriented medical record are that it promotes multidisciplinary collaboration among the various disciplines. It is organized in a method that facilitates ready access to the patient's current problems. It also allows members of the healthcare team to track and review the patient's progress over time according to their healthcare problems and concerns. The disadvantages of the problem-oriented medical record include the fact that this method is unfamiliar to nurses and other healthcare team members. It is more difficult than other methods in terms of the structured format of the progress notes. Problem, Intervention, and Evaluation, PIE, progress notes. The PIE method for documenting progress notes can be used in the problem-oriented medical record or with any other style of medical record. An example of PIE using a problem like postoperative pain is P for problem, pain related to abdominal surgery. I for interventions, monitor the patient's level of pain and administer analgesics as ordered, PRN. E for evaluation, pain level has decreased from 8 to 4 after analgesic medication. Assessment, Problem, Intervention, and Evaluation, APIE, progress notes. APIE is an expansion of the PIE method, but it adds assessment data. A for assessment. The patient reports an 8 level of pain, and the patient is guarding the incisional site. P for problem, pain related to abdominal surgery. I for interventions, monitor the patient's level of pain and administer analgesics as ordered, PRN. E for evaluation, pain level has decreased from 8 to 4 after analgesic medication. Case management and critical pathways. Case management and the use of critical pathways is perhaps the newest of the documentation systems. Case management and critical pathways are based on the premise that most patients with a specific medical diagnosis, healthcare problem, illness, and/or nursing diagnosis are more similar in terms of their anticipated treatments than they are different. Briefly stated, critical pathways are pre-planned plans of care that are generated with the efforts of the entire multidisciplinary team as appropriate according to the patient's diagnoses. They include interventions, timeframes, and expected outcomes. The timeframes vary according to the patient's level of acuity. For example, patients in the special intensive care unit have more frequent monitoring and care than a resident in a long-term care facility and a stable patient in a medical surgical unit after surgery without any complications. A variance occurs and is documented whenever the patient's established critical pathway is not followed. Variances can include patient-related, provider-related, and system-related variances. For example, if a critical pathway is not followed because the current patient's condition does not permit a particular intervention, or a provider fails to draw a pre-planned laboratory test, or the system fails in terms of processing and/or reporting the results of a radiological study, a variance has occurred. All variances are documented using this method of documentation and care planning. Not only are variances and other documentation significant and critical to the quality of patient care, they are useful and beneficial in terms of providing data that can be used in process improvement and performance improvement studies. For example, the analysis of variances over time may suggest patterns and trends that should be addressed in terms of increasing the timeliness, appropriateness, and completeness of care. An example of a sample critical pathway is a sample critical pathway for post-operative client. Pain management. Post-op, day 1. Expected outcome. The patient will verbalize a pain level of 5 or less using a numerical pain management scale from 1 to 10. Variance. If this expected outcome is not achieved, the variance is documented here. Date and time, signature and title. Day 2 post-op. Expected outcome. The patient will verbalize a pain level of 3 or less using a numerical pain management scale from 1 to 10. Variance. If this expected outcome is not achieved, the variance is documented here. Date and time, signature and title. Day 3 post-op. Expected outcome. The patient will verbalize a pain level of 2 or less using a numerical pain management scale from 1 to 10. Variance. If this expected outcome is not achieved, the variance is documented here. Date and time, signature and title. At risk for respiratory compromise. Expected outcome. The breath sounds are clear bilaterally. The patient will use the incentive spirometer and meet at least 80% of their established goal. The patient will cough and deep breathe while splinting at least every 2 hours. Variance, date and time, signature and title. Expected outcome. The breath sounds remain clear bilaterally. The patient will use the incentive spirometer and meet at least 90% of their established goal. The patient will cough and deep breathe while splinting at least every 2 hours. Variance, date and time, signature and title. Expected outcome. The breath sounds are clear bilaterally. The patient will use the incentive spirometer and meet 100% of their established goal. The patient will cough and deep breathe while splinting at least every 2 hours. Variance, date and time, signature and title. Guidelines for documentation. In addition to the legal aspects of documentation that were previously mentioned, other guidelines for documentation include the use of permanent ink, the use of only accepted terms and abbreviations, legible writing, accurate spelling, proper grammar, accurate dating and time of the entry, the signature and title of the person who documented the entry, and a professional tone. If an error in documentation occurs, a thin line that does not obliterate the entry is drawn through the erroneous entry. The notation error is written above the entry, and the nurse signs this notation with their name and title. Under no circumstances should any pre-charting or charting and documenting for others be done. Now is the time to discuss 2 practice questions that you will see on your examination in reference to communication and documentation. Which communication technique is the vaguest of all? A. Touch. B. Silence. C. A groan. Or D. A smile. The correct answer is C. A groan. Sounds like a groan are the vaguest of all of the above communication techniques. It can have many meanings. Touch has one meaning. It conveys caring. Silence can indicate thought, or it can simply be a pause in the conversation. Lastly, a smile is a universal sign of happiness or fondness. Now, let's do another one. Place the letters of a problem-oriented medical record progress note in correct sequential order. O, S, P, A, I, E. SOAPIE is the correct sequential order for the problem-oriented medical record. Congratulations! You are now ready to learn about the 4th and last integrated process, which is teaching and learning. Teaching and learning is defined as the facilitation of the acquisition of knowledge, skills, and attitudes to assist in promoting a change in behavior. Licensed practical nurses collect data, implement some aspects of the registered nurse's established teaching plan, and determine whether or not the patient has successfully learned. Basic terms and terminology relating to teaching and learning. Some of the basic terms and terminology relating to the teaching and learning process that you should know will now be discussed. The assessment of learning needs is the collection and analysis of data and information that reveals that the patient has an actual or potential learning need. Registered nurses analyze this data and information. Licensed practical nurses and registered nurses collect this data and information. A learning need, simply stated, is defined as the gap between what the patient should know and what they actually do know. For example, a learning need nursing diagnosis for a newly diagnosed diabetic patient may be knowledge deficit relating to the role of exercise in the management of diabetes. When the assessment of learning needs indicates this gap in knowledge about the role of exercise in terms of diabetes management. Andragogy is adult learning and adult learning principles. Pedagogy is childhood learning and childhood learning principles. The domains of learning are the 3 types or domains of learning. The 3 domains of learning are affective domain of learning, the cognitive domain of learning, and the psychomotor domain of learning. The affective domain of learning involves values, beliefs, feelings, interests, and other social and emotional elements. The psychomotor domain of learning entails hands-on skills, like using the correct procedure for the self-administration of insulin and using the correct procedure for monitoring blood glucose levels. The cognitive domain of learning is the knowledge and thinking domain. For example, a patient teaching plan for a newly diagnosed diabetic client will contain information about diet, exercise, and diabetic medications. Teaching is a planned, dynamic, systematic process like the nursing process. Teaching consists of the assessment of learning needs, the generation of a learning need nursing diagnosis, planning, implementation, and evaluation. It is an active process that imparts some knowledge, skill, or ability to a person with a learning need. Learning is the acquisition of new knowledge, skills, or abilities. When learning occurs, a change in the patient's behavior and/or attitudes should occur. The teaching-learning process. The teaching-learning process is a planned, dynamic, systematic process like the nursing process that includes the assessment of the patient's learning needs, data analysis, nursing diagnosis, planning, implementation, and evaluation. Assessing learning needs and other factors. During the assessment and data collection phase of the teaching-learning process, nurses collect information about the patient's learning needs, their strengths and weaknesses in terms of learning, their learning styles and preferences, their level of motivation, and other factors, including other patient characteristics and potential barriers that may negatively impact on the education and the effectiveness of the education. Learning styles, other patient characteristics, and barriers to education will be fully discussed later in this section. Analyzing learning needs data. After data is collected, the registered nurse organizes and analyzes this data in the same manner that the registered nurse analyzes data during the nursing process, using the professional judgment and the critical thinking skills of the registered nurse. Learning need nursing diagnoses. The registered nurse then generates a learning need nursing diagnosis, such as a knowledge deficit relating to active range of motion exercises, which is within the psychomotor domain of learning, a lack of knowledge about antihypertensive medications and their actions, which is in the cognitive domain of learning, a lack of motivation relating to the performance of self-care, which is within the affective domain of learning, and at risk for a deficit relating to the self-administration of insulin secondary to impaired fine motor skills, which is within the psychomotor domain of learning. Planning educational activities. Expected outcomes and selecting teaching methods. Registered nurses often collaborate with licensed practical nurses to plan educational activities for individual patients, their significant others, and groups of patients who share a common educational need. During the planning stage, the nurse generates learning objectives or expected outcomes for the patient or the group of patients. Like the nursing process and its expected outcomes or goals, educational-related expected outcomes are also SMARTTA. They are specific, measurable, achievable, realistic, time-framed, trackable, and agreed to by the patient. Learning objectives or outcomes are in terms of what the person will know or do after the education. They are also written according to the domain of learning that is being taught. For example, a psychomotor domain learning outcome could be, the patient will change their dressing using medical aseptic technique. A cognitive domain learning outcome could be, the patient will list all the foods that are not permitted with the soft diet. The format of expected outcomes relating to education is, the patient will, followed by a measurable and observable verb that is consistent with the domain of learning. For example, some expected outcomes for the cognitive domain of learning are the patient will describe, list, define, summarize, and discuss. Some expected outcomes for the psychomotor domain of learning are: the patient will perform and demonstrate the proper procedure for. Similarly, affected outcomes for the affective domain of learning could include: the patient will value or demonstrate a belief that. Teaching strategies must be selected based on the domain of learning that is being taught. For example, lecture and discussion are appropriate strategies for the cognitive domain. Demonstration, return demonstration, and practice are appropriate strategies for the psychomotor domain of learning. Other strategies that can be used for each of the domains of learning are: online classes and information, reading material, videos, posters, and pictures for the cognitive domain of learning. A video showing the procedure, live demonstration, simulated practice, and the use of a medical model for the psychomotor domain of learning. Values clarification exercises and role-playing for the affective domain of learning. The content and information for the educational activity should be sequenced from the known to the unknown, from the simple to the complex, and from the least threatening to the most threatening. Additionally, psychomotor skills should be taught by going step by step through the procedure, beginning with step 1. Pedagogy is childhood learning. Andragogy is adult learning. Unlike pedagogy, adult learning has immediate usefulness in terms of solving problems. Andragogy involves active learner involvement and participation. The curriculum and content are based on the learner's problems, needs, and desires. Implementing the teaching plan. When time permits, psychomotor skills are best taught with short teaching sessions for each step of the procedure, after which time the patient can practice what they have just learned. The attention span and short-term memory may interfere with the learning process. Therefore, the teaching sessions should be brief and modified based on the individual's needs. Evaluating the outcomes of education. The two kinds of evaluation that are used for education are formative and summative evaluation. Formative evaluation is determining how effective the education is as it is being conducted. Summative evaluation determines how effective the education was after the educational activity has ended. Formative evaluation allows us to adjust or modify the teaching and/or to overcome any barriers to learning during the teaching session so it can be made more effective when necessary. Summative evaluation allows us to determine if the education that was provided has met or exceeded or not at all met the patient's expected outcomes in terms of the knowledge, skills, and abilities that was taught. Did the education close the gap between what should be and what actually is? Evaluation methods also vary according to each of the domains of learning. Questioning and giving a test are ways that cognitive domain learning can be evaluated. Having the patient return demonstrate a hands-on or psychomotor procedure is the best way to evaluate psychomotor domain learning. The affective domain can be evaluated by observing the patient's changes in terms of their attitudes or values, for example. Learner characteristics and preferences. Learners, like all other human beings, are different in terms of the characteristics and preferences. They vary in terms of the cognitive abilities and their fine and gross motor skills, which impacts the psychomotor skills acquisition. They differ in terms of their learning styles and preferences. They also vary in terms of other characteristics that can impact on the teaching and learning processes. Example of the learner's characteristic learning styles and preferences are as follows. Visual learners. Visual learners learn best and have a preference when they are able to see things like an educational video, a live teacher demonstration, medical models, pictures, and diagrams. Verbal learners. Verbal learners, on the other hand, learn best and have a preference when they are able to hear the teacher's spoken words. These spoken words can be delivered to the learner in a live presentation or with a taped presentation. Tactile learners. Tactile learners learn best and have a preference when they are able to learn by doing rather than seeing or hearing. They learn best with hands-on experiences and the opportunity to manipulate, practice, and experiment with things. Active learners. These learners prefer to learn when they are actively engaged with others, including the teacher. For example, when they are discussing things with others and they are working on a small group project. Reflective learners. Unlike active learners, reflective learners tend to prefer working alone and thinking alone in solitude rather than interacting with others and working on small group projects. Sequential learners. These learners learn best when content is orderly, logical, and presented in a step-by-step manner. Sequential learners will then follow these logical and orderly steps to learn the content or skill. Then they will solve problems related to the content or skill that was taught. Global learners. Global learners, unlike sequential learners, do best when they themselves, rather than the teachers, are able to organize the content themselves during the learning process. Sensing learners. These learners prefer concrete and practical real-world learning to solve a problem rather than abstraction and information that they cannot readily use. Whenever possible, the nurse should use a variety of methods that meet most learner preferences when a group presentation is being given. Barriers related to learning. Some of the potential barriers to learning and possible ways to overcome these barriers will be discussed now. English language barriers. Teaching and communicating with patients who do not have English as their primary language pose challenges in terms of teaching. The patient may not understand what is being taught. Some of the things that you can do to overcome this barrier is to use pictures, to provide written information in the patient's native language, to get the help of a professional translator, to use simple terms and words without any medical jargon when the person is limited in terms of the English language, to speak slowly and clearly, and to clarify and restate whenever necessary. A low level of literacy. Individuals vary in terms of their levels of literacy and ability to read and understand material. For example, some patients can read and understand complex material with ease. Others may have poor literacy skills that cause them to only understand material that is written at or below a 6th grade reading level. The nurse must determine the patient's literacy level and provide them with material and information that they can read and fully understand. Poor health literacy. Patients are considered health literate when they are able to understand information and use it to make appropriate healthcare decisions. Patients who have poor health literacy in terms of health-related issues need nurses and other healthcare providers to use simple terms. They also need them to provide simple information at the patient's level of understanding without any medical jargon and complex information that the patient cannot understand or comprehend. The lack of motivation and readiness for learning. Patients have to be motivated and ready to learn before learning can occur. Nurses can motivate and encourage patients and significant others to learn by convincing them that the education will help them to solve their healthcare problems and concerns and also empower them in terms of making knowledgeable decisions relating to their health and healthcare. The presence of stress and pain. The presence of pain impedes learning. The nurse should consider using interventions, including pain medications, to reduce the pain prior to the teaching episode. Mild stress is a motivator, but high levels of stress hamper effective learning. Again, the nurse should consider stress management strategies to reduce high levels of stress prior to the learning. Age-specific variables. The age and developmental level of patients also impacts on the teaching and learning process. Some examples of teaching modifications that are based on age and the learner's developmental level include simple, concrete, and belief explanations for the toddler, simple and brief explanations for the preschool child, the encouragement of questions, and more detailed explanations for the school-age child and adult, like teaching for the adolescent. Health beliefs, including spiritual, cultural, and self-efficacy beliefs. Patients who value health promotion, and wellness will be most likely to be motivated to learn when compared and contrasted to other patients who do not value these same things. Some of these beliefs can be spiritual, cultural, and intrinsic in terms of their origin. For example, some believe that medicine men perform the role of a healthcare provider rather than a medical doctor. Others may have a cultural belief that immunizations are dangerous and not necessary. Still, more may have an intrinsic belief that they are not able to do anything to solve their health-related problems. It is all out of their control. These patients lack feelings of self-efficacy and empowerment. Nurses can overcome these barriers to learning by instilling different values and beliefs, at the same time that any existing values and beliefs are incorporated into the teaching as much as possible. Cognitive, psychological, and emotional challenges. Nurses have to accommodate for any actual or potential cognitive, sensory, psychological, and emotional barriers to learning. For example, cognitive limitations can be overcome with slow, brief, simple, and understandable explanations. Psychological and emotional barriers can be decreased when the nurse-patient relationship is built on trust, respect, caring, and compassion. Physical and functional limitations. Sensory barriers, like impaired vision and hearing, can be overcome with louder discussions with clients affected with a hearing loss. Large print materials and braille materials can be used for the visually impaired. The use of sensory assistive devices, like glasses, magnifiers, and hearing aids, can help for the hearing impaired. Accommodations and modifications must also be done when the learner has a functional limitation that can potentially hamper learning. For example, a patient with poor fine motor abilities and coordination may need an assistive device that accommodates for this. Now, it is time for you to be challenged with 2 sample questions relating to the teaching and learning processes. Question 1. The ultimate purpose of teaching and learning is for the patient to A. Understand about their healthcare problem. B. Be knowledgeable. C. Be enlightened. Or D. Change behavior. The correct answer is D. To change behavior. The ultimate purpose of teaching and learning is for the patient to change behaviors that can correct their healthcare problems and needs. Understanding, being knowledgeable, and enlightenment are needed for a change of behavior. But it is a change in behavior that is the ultimate goal of teaching and learning. Now, here's another one. What strategy would you use to teach a patient how to check their own blood pressure? A. Discussion. B. Demonstration. C. Reading material. Or D. Effective learning. The correct answer is B. Demonstration. You would use demonstration to teach a patient how to check their own blood pressure because this is a psychomotor skill. Psychomotor skills are best taught with demonstration. We have now finished discussing the 4 integrated processes that will be covered on your examination. We are now beginning the safe and effective care environment, coordinated care and safety, and infection control portion of the examination. The practical vocational nurse collaborates with healthcare team members to facilitate effective client care. They must be able to provide information about advance directives, advocate for client rights and needs, promote client self-advocacy, assign client care and/or related tasks, for example, assistive personnel or LPN/VN, involve client in care decision-making, contribute to the development and/or update of the client plan of care, for example, client preferences, review current information, participate as a member of an interdisciplinary team, recognize and report staff conflict, participate in staff education, for example, in-services and continued competency, use data from various sources in making clinical decisions, monitor activities of assistive personnel, maintain client confidentiality, provide for privacy needs, follow up with client after discharge, participate in client discharge or transfer, provide and receive reports, organize and prioritize care for assigned group of clients, practice in a manner consistent with Code of Ethics for nurses.